Principles of Pathology, Pathophobia. The topic that we are going to deal today is neoplasia. The first section deals with the basics, the sort of the principles to give you the foundation for the rest of the chapter. Neoplasia can be defined as any abnormal mass of the tissue as a result of mutations resulting in a disorganized or a disordered cell growth. The very important principle to tie in here is that neoplastic cells are monoclonal. Now this requires a bit of explanation. Let's say for example we have four normal cells of a tissue having two isoforms of a gene A, A1 and A2. So 1, 2, 1, 2. Now, normally we can see that cells containing the population of A1 and A2 are almost equal. That is, ratio would be 1:1. Now what happens here is that when this cell undergoes neoplastic transformation, the population of the cells containing A1 gene would rather increase. Now this refers the cells are monoclonal, and the characteristic property is called as monoclonality. Normally speaking, the cells are polyclonal, but now the population of the cell containing A1 would be very high once the neoplastic cells start to proliferate, and this is monoclonality. Now we can think of two examples over here. The one would be obviously the uterine carcinoma, in which we use the G6PD isoforms, wherein actually because of the X inactivation, usually there are two, first for example A, B, and another cell has A, B, A, B, A, and B. Now A and B are the two isoforms of the G6PD, and normally only one of them is present, and this is a random process because of X inactivation. So therefore only out of the two one will survive, and usually the number of isoform A's to B is 1:1. So the isoform is almost equal, 1:1 is expressed. However, in case of the hyperplasia, whenever these cells divide, all of them undergo cell division. Still, still the ratio would be 1:1. However, if the cells undergo such a transformation, one of the cell undergoes neoplastic transformation, this would cause the isoform A to increase substantially over B, and this would obviously distort the ratio of A's to B isoform of the G6PD. Similarly, the androgen receptor can be used in case of testicular carcinoma as a marker, basically, or marker. Okay, so monoclonal, again, the neoplastic cells derived from single mother cell, and monoclonality is irrespective of the tumor is benign or malignant. Both of them will have the monoclonal feature, because basically the division of a cell from a single mother cell, whether benign or malignant, doesn't affect that whether it is invasive or it metastasize. Okay, so both the high principle over here is that irrespective it is benign or malignant, the cancer cells are monoclonal, sorry, the neoplastic cells are monoclonal. However, one thing to be kept in mind over here, as we progress through the chapter, you will come to know that usually a single gene can be found, a single mutation, which would be the principal mutation for developing the cancer, is present although in whole population. However, there are many driver mutations that actually are responsible for the sustaining the new neoplastic cells of that cancer, of that neoplastic tissue. Okay, now the first example we have already gone through is G6PD. The second example would be the IgG light chain. Now usually Ig light chain has kappa and lambda. Kappa and lambda are the light chain which are coded by different segments, different gene encoding segments. Usual ratio for these would be 3:1 or 2:1. Now in B cell lymphoma, this is sort of disturbed. Either of the chain would increase in high amount. Normally what happens, normally in any type of the reaction or in any type of the, whenever there is the proliferation of the B cell, there is a proportionate increase in the kappa and the lambda light chain so as to balance this ratio. This ratio is balanced. But in case of the B cell lymphoma, uh, this is altered, this is disturbed, okay. Monoclonality. Okay, now any neoplastic tissue consists of mainly two parts. The first one will be the parenchyma. The parenchyma are usually the functional segment of any organ or tissue, and obviously for a neoplastic tissue or a tumor, that would be its cells, the neoplastic cells. Now for the stroma, we refer the stroma as reactive. The stroma is reactive because it causes the response of the host in the same way as we can see in case of the inflammation, and hence the stroma elicits the immunity of the host. Now it may also elicit a tissue repair, and it may also involve scar formation. Now what happens is here is that uh, that stroma is usually made up of connective tissue and blood vessel. Stroma is made up of connective tissue and blood vessel. And how these are made, we'll talk about it. Neoplastic cells in the parenchyma induced desmoplasia. Now, desmoplasia involves the destruction of the normal extracellular matrix, such as with the help of the enzyme like the metalloproteinase, and also promotes fibroblast. Uh, and the fibroblast, in return, will provide the collagen, and the newly formed connective tissue acts as a scaffold, right? Now let's see what happens over here. For example, is that neoplastic cells are present in the center. Normally they are present in the center, and now this is the surrounding sort of the uh, extracellular matrix. Now whenever the neoplastic cells are invading, they usually secrete the certain enzymes. Let's say example would be the matrix metalloproteinase, which help in the digestion of the surrounding cells and the surrounding tissues, and this would cause the cells to be able to invade their surroundings. Now uh, however, that they also invite the fibroblast cells. Sort of the fibroblast cells actually secrete collagen once again, but this provide a framework or supporting framework as scaffold for the cancer cells for the while they spread to the new tissues. Okay, neoplastic tumors can be either benign or malignant. Now benign tumors don't metastasize, or they remain localized to the tissue in which they are present. Benign tumors, generally speaking, are well differentiated. In contrast, the malignant cells have the property of metastasize. Actually, one of the property, one only single property, if I ask you to say about the malignant cells, would be their ability to metastasize. Other properties for the metastasis of the tumor would be the anaplasia and differentiation and the local invasion. Before we dive into the next of the section, we need to have a look about the nomenclature of the neoplastic cells. The way I remember it is by on the basis of the tissue of origin. Let's say, for example, we have the epithelium, and the epithelial cells are usually named by oma, oma, and in case of the malignant cells by carcinoma. Now, if the epithelium, the tumor arises from a gland, it is called as adenoma, and in case of the malignant cancer would be adenocarcinoma. Similarly, if it forms a papilla this, it would be it would be called papilloma if it's benign, and papillary carcinoma if it's malignant. If it forms a cyst, it would be cystadenoma, and if it forms malignant, it is cystadenocarcinoma. For in case of the mesenchyme, generally speaking, all the tumors of mesenchyme, if benign, should end with oma, and if we have a malignant, we call it sarcoma. And now you can play the game as fibroma, fibrosarcoma. Of a lipid, of adipocytes, it would be lipoma, liposarcoma. For osteocytes, osteoma and osteogenic sarcoma. If the mesenchyme is smooth muscle, it would be leiomyoma or leiomyosarcoma. If it's skeletal muscle, it would be rhabdomyoma or rhabdomyosarcoma. A special attention we need for the lymphocyte is that their benign form doesn't exist. The benign form of the lymphocyte doesn't exist because if there is neoplastic proliferation of the lymphocyte, it automatically points to malignant transformation. Okay. Now, most of the benign and the malignant neoplasms, all of the parenchymal cells in them closely resemble one another. Let's say, for example, we have the neoplastic cells. Now, all of the neoplastic cells normally are similar in morphology. However, in a certain set of tumors, the neoplastic cells are of different variety. And the property over here, because of which they are different, would be the divergent differentiation. Now, this can be due to they are arising from a single germ layer, or if they can arise from a multiple germ layer. The cancers arising from the single germ layer would be malignant mixed tumor of the salivary gland origin, and when it's benign, it's called pleomorphic adenoma. The pleo refers to multiple shape and the size and the variability of the neoplastic cells. Now, if it is the renal enlarge, it would be only in malignant form called Wilms tumor. If the cancer if the neoplastic cells arise from the more than one germ layer, then it would be usually seen in the gonads because they have totipotent stem cells, and the benign form would be called as mature teratoma or ovarian cystic teratoma. Mature teratoma may be also seen in the embryonic rest cells, and immature teratoma or teratocarcinoma. Teratocarcinoma if malignant. Okay, so Hematopoietic cells and lymphoid tissue tumors are automatically malignant. Anytime there is neoplastic proliferation of lymphocytes, it's malignant. It would be leukemia, lymphoma. This particular example is high yield. Other examples include basal cell carcinoma and the testicular epithelium carcinoma, which would be the seminoma and embryonal carcinoma. One and the Wilms tumor of the renal analgae. One more example would be included when the neoplastic proliferation is automatically malignant. No other benign form is seen in this uh, particular subset of cancer. Cancer is the second leading cause of death after cardiovascular diseases. In case of the adults, the cancer is second after the cardiovascular diseases, followed by cerebrovascular diseases. In case of the children, the cancer is the fourth, comes on the fourth position. First would be the malaria, and second, unfortunately, is other road accidents, which actually can be avoided, uh, and even HIV, which can be avoided uh, by good amount of precautions. Okay. We can divide the epidemiology of the cancer rates in form of the incident rate and the mortality rate. Now, the breast cancer and the prostate cancer are most common, breast among female, prostate among male, followed by the lung cancer and followed by the colorectal cancer. Now, notice the change over here that breast and the prostate cancer, although are most common, but the lung cancer tops the mortality. This sort of brings us to an important point, uh, and one of the greatest mechanisms by which we can handle cancer is by prevention. Prevention. Because for the breast cancer, uh, now the only way only way we can uh, actually particularly treat a cancer is by actually preventing it, by early diagnosis. So in cases of breast cancer, we have many screening methods such as the mammogram, the self physical examination. For prostate, we have the digital rectal examination or the PSA screening test. How even for the colorectal cancer, we have the colonoscopy and the stool examination. But for lung cancer, we hardly have some practical screening method, and this sort of makes it difficult to diagnose early, and we catch it way after it has produced the symptoms. And obviously, if it's late, we cannot there's not much left we can do. And important like statistics for this thing would be that surprises me is that what would be the 5-year survival rate for the lung cancer 30 years ago? That would be about 15%. And what's the survival rate now? Is the answer is about 15%. So actually this statistic is important and signifies that there's not much change in the rate of the survival rate of the lung cancer, because there are no improvement in the screening method. There are no new practical screening methods available, and hence still the lung cancer remains the #1 cause of the death. Neoplastic cells have certain characteristics. First one would be the differentiation and anaplasia, local invasion, metaplasia. These characteristics are sort of important here, so that we can differentiate between the benign and the malignant transformation. The differentiation would represent extent to which the neoplastic parenchymal cells resemble the parenchymal cells both morphologically and functionally, while anaplasia represents lack of differentiation. Anaplasia we can think of it as lack of differentiation. Anaplasia. Local invasion refers to the in how much the cancer has the capacity to invade its surrounding. For example, these are the cancer cell, these are the surroundings. The tendency to move out over here is called invasion, while the capacity to spread from this location to this location would be metastasis. And this is important principle over here, is that metastasis is actually the spread of the cancer cells from one location to another location. However, the local invasion is the invasion of the surrounding tissue. So sort of you can think of it as that local invasion is necessary for metastasis, but this is a general concept, this is a general principle, and examples do exist wherein the invasion is less, slow growing tumors that invade less, however they have massive metastasis.
Before we go further, we need to understand the difference between the metastasis and local invasion. Now, let's say, for example, we have the malignant cancer cells over here, right? Now we have the surrounding tissue over here. And now, if we want the cancer cells to metastasize, we need the invasion of the local tissue. Now, what happens is that if the local invasion occurs, that is, the destruction of the normal tissue in the surrounding of the neoplastic cells allows for the metastasis. So, local invasion occurs uh, usually occurs early in the phase of the malignancy, and this once the invasion has occurred, this leads to the cells invading the area and then they are able to metastasize, right? So metastasis is the spread of cancer from this side to, let's say, for example, uh, let's say this cancer is the stomach. This is present in the stomach. Let's say we have stomach over here. Now, with the venous channels which move from the stomach and enter to the liver, from stomach to the liver, some cells metastasize and enter and into the liver and turn it into the malignant, turn it as a malignant. So this would be the pathway, right? Okay, once there is invasion, the tumor cells can go into the lymph vessels. Okay, so now we need to understand that once the tumor cells actually invade the surrounding area, the tumor cells can follow lymphatic route, they can follow a blood vessel route, also they can follow uh, via the direct spread into the body cavities, as in case of the ovaries are usually hidden for a long time because they have a lot of space in the body cavity surrounding, and this makes the ovarian carcinoma uh, a poor prognosis, because when usually the clinical symptoms are present only after there is much of invasion occurred, right?
Generally speaking, benign tumors are well differentiated, In contrast, the malignant cells exhibit little or no differentiation. However, there are some exceptions wherein the differentiation do occurs. However, the differentiation still is sort of the new cells are morphologically different from the parent or from the normal parenchymal cells. However, exceptionally, the well-differentiated, normal-looking cells having the neoplastic malignancy feature are seen in case of the thyroid adenocarcinoma and squamous cell carcinoma. The anaplasia refers to lack of differentiation, and it would be the hallmark of malignancy. Now, the anaplasia is associated with mitosis. Mitosis. The tumor cells are undifferentiated, and hence they obviously be having the property of multiplication, and hence they have some mitotic figures, the hyperchromic nuclei and hyperchromic nuclei, and all these features that points towards uh, the rapid cell growth capability and the distinct nuclear morphology because of the hyperchromic nuclei and some increased nucleoli also, that is increased nuclei and increased nucleoli. Moreover, the cells would be having different shapes and different size, because remember, the tumor cells are growing in a disordered, disorganized, unregulated manner, and probably they don't care about the size and the shape, and also about their function. So they are just growing rapidly and have different shape, size, and range of the size and the shape, and this points to the pleomorphic nature. Moreover, since the cells are dividing so rapidly, there is in the center, the neoplastic cells are present usually in the center, surrounded by the stroma. Stroma consists of the blood vessel. Now, blood vessels provide blood. However, the central part of, usually, generally speaking, the central part of the tumor is hypoxic, and this in turn causes ischemia and causes a central necrosis. Moreover, there would be the loss of polarity because the general organization and the orderliness is disturbed because of the unregulated growth of the neoplastic cells. Now, this slide is for the tumor giant cells. We can easily appreciate over here the tumor giant cells are there, and we can uh, uh, okay, and this one would be the nuclei of the tumor giant cell. So many nuclei are present over here, and this actually shows the pleomorphic nature, range of size, very giant cell, smaller, and even smaller cell. So okay.
Okay, in this slide, look out for the follicles here. This one, and this one. With the help of the follicles, we can say that this slide is of thyroid. Now, these were the normal about normal follicles. Now, let's see this side once again. Now, look here. Here, look at these cells, which show some different irregular features. The how irregular they are, and also have a look on this follicle and its follicles. These follicles. See the wide range of size and the shape. See the amount of the hyperchromicity over here, over on this one, and the hyper and some hyperchromicity over this one. You can easily you can tell that there is some uh, variability in the follicle size and the shape, along with some cells are hyperchromic with hyperchromic nuclei. So all these things point towards the anaplastic nature of this thyroid carcinoma, right?
Okay, metastasis. The metastasis would be the single hallmark feature for defining malignancy. If I ask you what is the single defining criteria for malignancy, that would be metastasis. Metastasis. Now, metastasis is something which is different from local invasion. What is metastasis? Metastasis is the transfer of the neoplastic cells, or its spread of the neoplastic cells from one location to the other location. What location? Usually physically distant from each other. However, if the local invasion refers to the exit of the neoplastic cells from their normal surrounding into the normal tissue into the surrounding tissue. Now, invasion may be followed by malignancy. Sorry, followed by the metastasis. However, a tumor may invade aggressively and may not metastasize. Now, the examples would be for such tumors would be glioma and basal cell carcinoma. Remember, these invade aggressively, however, they don't metastasize. This would be the example for the secondary deposits in the liver, which are usually from the pancreatic carcinoma and which have metastasized uh, here. Mhm. With this, we can conclude our discussion on the basic principles of neoplasia. See you in the next one.